Good morning, Aurora. I'm Ruby Sue, bringing your weather to you. Today is a little bit more mild. I hope everyone enjoyed the storms yesterday and last night. We have cloudy. I don't know if you can see, but I've got my cloud pen on today for you guys. So today we are experiencing a low of 39 degrees, a low of 35 degrees, a high of 39 degrees. It's pretty mild outside. We're a little bit blustery, so a little bit of a mix of snow and rain today. Tonight is a low of 31 degrees and a high of 37 degrees. Moving into Thursday, we have a low of 40 degrees and a high of 45 degrees. Friday, starts to get a little bit nice springtime April weather with bringing us the sun. Partly sunny, partly cloudy, low of 43 degrees, high of 47 degrees. We're getting a nighttime low of 26 degrees, high of 36 degrees. Saturday, gorgeous and sunny. What are your plans for Saturday? Low of 45 degrees, high of 54 degrees. Sunday brings us some cloud and rain with a low of 47 degrees and a high of 56 degrees. Thank you for tuning in. Stay tuned for today. Not only Good Morning Aurora, but Buenos Dias Aurora. See you soon.
Good morning, Aurora. The time is 9:03 a.m. You are listening to and watching Good Morning Aurora, the second largest city's first daily news podcast. We have a special guest today and a special topic to talk about. My guest is Dr. Anna Young, OBGYN at Northwestern Medicine, also here representing the Illinois Department of Public Health. And we got a lot to talk about. First, how you feeling?
I feel good.
Okay, good to see you.
I had my coffee this morning. We're ready to go.
Got coffee, got the jacket on. We are ready for this.
Exactly.
So we are going to be talking about the rise in Illinois on congenital syphilis.
Yeah.
Okay, and some other women's health issues and topics as well. Okay. So first things first, in your bio, you are current resident at Northwestern Medicine. Mm-hmm. Congenital syphilis is on the rise in Illinois. What is behind the rise and what is this disease?
Yeah, we can start with what it is. So I think it's always best to start with what is syphilis in the first place. So syphilis is a sexually transmitted infection. Mm-hmm. Anyone can get it when they have any sort of sexual contact with someone who already has syphilis. Mm-hmm. And if a mom is pregnant, or if anyone is pregnant and contracts the disease, they can pass it on to their baby. And that is known, or the manifestations of that is known as congenital syphilis.
Okay.
There's a wide spectrum of different ways that it can present when it comes to congenital syphilis, but all the more reason in terms of why being treated or being diagnosed and then being treated is so important.
Yeah.
The rates at which congenital syphilis has increased in Illinois, or what we've been seeing in terms of the trends, actually correlate very much to what we're seeing nationally. And we can talk about the mechanisms at which, that's been driven, but a lot of it has actually been due to the lack of access to care and resources, including treatment. Years ago, this was something that we more rarely saw or even rarely talked about. To be honest, it was something that I didn't really see in my training and only talked about or read about in books up until most recently. And so I think it's something that is definitely getting a lot more attention, and very importantly so.
Right. Now, on the Illinois Department of Public Health's website, which we'll link to in the description of this video, there is more information and follow up.
Absolutely.
The lack of resources, though, I'm curious. Why has there been a lack of resources?
I mean, we can talk about our healthcare system all day,
right? Yeah,
and what certain patient populations have access to in terms of healthcare, insurance coverage, things like that.
Gotcha.
But I think a lot of it is understanding what it is, having someone to talk to about it, including their provider, and being able to get to clinic and access that treatment and care and the follow-up that comes with that as well.
Okay. Now, if untreated, what kind of damage can this disease do?
Yeah, it can be very serious. First, for the pregnancy itself. So syphilis infection or being infected with syphilis can actually lead to miscarriage. It can also lead to preterm birth or preterm labor. It can also be associated with fetal demise or stillbirth.
Oh, wow.
So it is very serious. If a baby is born with congenital syphilis, it can present in a variety of ways. A lot of things that we see in more severe cases is issues with formation of bones, liver issues with the spleen. It can even cause blindness or deafness.
Wow.
And later in life, even if a baby is born with congenital syphilis and doesn't necessarily have those things at the beginning or early on in life, a lot of times we see the manifestations later in life in terms of, evidence of developmental delay and things like that.
That's terrible. Wow. Okay. Now, perinatal syphilis warm line. Tell us how those efforts have been in raising awareness and prevention. Again, this is something that comes directly from the website, and for follow-up information, we'll put the link for folks.
Absolutely. The Warm Line is a great initiative that was kind of added on to the already existing HIV Warm Line. It's actually a line specifically meant for providers. So any health provider that diagnoses a patient with syphilis or comes back with a positive screening test can call this helpline, and they can be directly connected to an expert that is well-versed in treating syphilis in pregnancy and also giving resources and information about how to handle congenital syphilis as well. Wow. It's also a great way to connect with resources locally. So a lot of times one barrier to care is that a lot of providers don't know how to treat this or follow up.
Right.
And so because it's something that a lot of people just aren't used to seeing. And so that Warm Line is able to connect providers with the resources that are necessary, including the IDPH, or the Illinois Department of Health.
Now, it's on the rise in Illinois. And good morning to everybody if you're just now joining us. Time is 9:09 a.m. Heather Sturm, good morning. It's on the rise in Illinois. In the state, are there certain zip codes, counties where it's more prevalent right now?
Yeah, this is data that I believe is actively being collected.
Okay.
I think the trends that we're seeing is people who necessarily have greater or lesser so access to care, but also where we see people of higher risk, higher concentrated population, Chicago being one of them, and so I think this is something that we're still trying to understand in terms of the trends and where we're finding it. But all the more reason to connect with the IDPH, because they are the organization directly tracking these numbers, and keeping that in mind in order to actually help with prevention.
And the tracking of it is also via the CDC. Is that correct?
Yeah, so the CDC is like, we all know the CDC. We all
We
love
do.
the CDC.
Everybody knows that now. It's the most famous acronym now.
So they as well are, if anything, I would say one of the greatest resources for understanding congenital syphilis and what we're seeing in terms of the epidemiology behind it currently. But locally, the IDPH is kind of that resource, and then the CDC kind of looks at it from a national level.
Interesting. Good to know. All right. Time is 9:11. Good morning to you all for joining. Thank you guys for joining us. We have an interesting discussion, very important discussion today with Dr. Anna Young of Northwestern Medicine here representing the Illinois Department of Public Health. Good morning to you guys. Okay. Now, here's a good question. How does your role as an MD interface with the Illinois Department of Public Health?
Yeah, I think we all as health providers play a role in what the IDPH does. It is our responsibility to, once a patient is diagnosed with syphilis or we're concerned about congenital syphilis, it's our responsibility to connect that patient with the IDPH and the resources that they offer, but also, report what we see and our concerns so that we can use that data to, create initiatives in the future for prevention. And so I would say we're all kind of in this together.
Right.
And all behind this initiative and really trying to do our best and trying to find any sort of underlying mechanism that we can address together with IDPH.
Okay. Now, with congenital syphilis and everything, if someone does feel that they've been exposed, what would you say is the first step for them to do? Speak to their healthcare provider?
Absolutely. Get tested.
Okay.
There's varying recommendations for based on your personal characteristics or, age, things like that, in terms of when you should get tested, how you should get tested, things like this. But ultimately, if you are ever concerned about any exposure to any sexually transmitted infection, the first thing that you should do is call your health provider and be tested.
Okay. Thank you very much for that. All right. Next question. Our Aurora listeners are always interested in wellness fairs and events. What does the Illinois Department of Public Health have coming up locally that people could take part in?
Yeah, I would say there's many events throughout the year, actually. The IDPH does a great job in linking with local health departments as well as local community-based organizations and even faith-based organizations to kind of link up with what is going on locally in different communities that are facing any sort of health challenge. One thing in their Office for Minority Health that they've done that I think is wonderful is their Wellness on Wheels. So it's actually like a
Wellness on Wheels.
A truck, not a food truck, but like a real truck that is actually a clinic, so to speak, where they can bring this anywhere. And they can offer physical exams, health screenings, vaccines, things like this. And all of that is available on the website so that if anyone wants to partner with the IDPH and actually have something like this, they can do that. They're also very involved and have a lot of things in place with the state fairs that go on every year. So if you all are ever interested in kind of learning about current health topics or even asking any sort of question, the IDPH is usually there to answer those questions.
Wellness on Wheels. Is that on the website?
Yeah.
Okay. Wellness on Wheels. So the Wellness on Wheels truck will come to your organization's event?
You can reach out to them. They will partner essentially with anyone.
Okay.
Yeah.
That is good to know.
Getting inspired over here.
That is good to know. Yes. Well, we have a VNA Healthcare, which is local, the Northern Illinois Food Bank, Aurora Food Pantry. They do a lot of great things when it comes to people in the community, helping them out. And that wellness aspect, nutrition's all part of that and everything. Yeah. But having access to that quick care is important. It could be really beneficial. So I'm going to see what we can do. I'm going to look up that Wellness on Wheels.
He's on it.
And if a brother can get that, wouldn't that be cool, you guys? Hey, Curtis, man, I saw you got Wellness on Wheels and you got a taco truck right next to it. We might. You never know. You never know. Okay, real quick, the time is 9:15 a.m. You are listening to and watching Good Morning Aurora, the second largest city's first daily news podcast. We're here discussing congenital syphilis, its rise in Illinois, with Dr. Anna Young of Northwestern Medicine, representing the Illinois Department of Public Health. Okay. Now, this is the part of the conversation where we get into some of the general discussion about women's health.
Sure.
So, diet and exercise. I'd like to ask about the diet and exercise and the role that a regular healthy regimen can play in a person's life.
Yeah, I would say diet and exercise are important for anyone at any age. No matter how you identify or where you're at in your life. I always tell people the earlier that you can set important, healthy goals for yourself, the better. But there's large amounts of data that has shown that healthy diet, plenty of exercise, at least 150 minutes a week of moderate exercise. So that's kind of like fast walking, so to speak, or something equivalent. Actually plays a role in all aspects of health. So cardiovascular health, muscular strength, and just mobility in general, mental health.
Okay.
Even actually like menopausal symptoms. I think I get a lot of questions about like, how do I manage these symptoms? It plays a lot into menopause as well. So I would say that it plays into any health issue.
Okay.
Even if you are already combating like a chronic illness or a chronic disease such as cancer, the healthy diet and exercise can really make a difference in your life as well.
Interesting. That's very good to know. How has your experience as an OBGYN? Tell me before the pandemic and since. We know people have gone through a lot health-wise. We know that. But in regards to your patients, what did you notice before the pandemic and since? You're one of a very select few of healthcare experts with direct access to patients that we've talked to. So I'm curious, what's that been like, pre-pandemic and then life since?
Yeah, I think globally one thing I've noticed is that patients pay a lot more attention to what's going on in like current events and ask a lot more questions.
Okay.
I will say the topic of vaccines has been more important than ever and constitutes for many patients a majority of my visit with them.
Okay.
And people have a lot of thoughts and feelings about it. And we can kind of go over the challenges behind that. But I think within the context of pregnancy, as you can imagine, that can be difficult for patients. And so really knowing the data well and being able to explain that to patients and reassure them how important it is to be vaccinated has become really important. And that's kind of bled into other things like being vaccinated against the flu. More recently, we've been talking a lot about measles, immunity to measles now that we have a measles outbreak.
Yeah, that's on the website too.
Chickenpox, things like that. And so I think infectious diseases, period, has been, on the rise of a huge topic of conversation in a lot of my visits with patients. And the level of concern, the level of understanding has varied drastically.
Yeah, I do. So you're right. People are concerned. They definitely are. But I think, too, one thing the pandemic really showed was that, the rise in Dr. Google.
Yeah.
Right? As soon as they hear a little twitch,
Yeah.
Oh, no, I'm not going to make it. So I think that even a person's assumptions, a person's nervousness may lead you to think one thing, but reaching out and having an expert, talk about reaching out to your physician is very important. I still want people to do that.
Yeah, I would argue too, I think over the years, even during the COVID pandemic, the role of social media that and what it has played in people's health decisions has been pretty significant. I can't tell you how many times I've had patients come to me and say, I watched a TikTok video about this patient who went through this during their labor and I'm concerned about this. And I think in a world where we've become a lot more virtual, that's been more prevalent thing for patients in terms of where they get their health information and who they are trusting.
Right.
And I just
What's been the adverse reaction to that though? I mean,
Yeah.
when they come to you, right, with a TikTok video, like how do you process that?
Yeah, I think, I want patients to have access to health information in whatever avenue. And I think social media is great, but I want that health information to be accurate and from someone who has the knowledge and experience to be able to give that advice. And so when we talk about Dr. Google and things like this, or other people who are maybe advising on certain health matters, I think I always caution people about where they're getting that information from and what those claims are based off. Is it evidence-based? Is it, are these things actually true?
Right.
And I think, it's important to get multiple perspectives. And I always try to be as open as possible to patients' concerns.
Right.
But yeah, there's a lot of misinformation out there, and we have to be careful.
Yeah, there is. And so I've asked this question about social media to a few of the guests that we've had, because on the one hand, more hospitals and your VNA healthcare, like they're embracing what social media is. So now they've got a reel about the benefits of eating broccoli. But unfortunately, that's not what's getting the shares and the likes and all that kind of stuff. So I see it as like, man, social media is helping, but there's a lot of it, just like you said, misinformation. There's so much of it out there, and sifting through is very important. So I'll tell you guys this: if you see that it comes from the IDPH, hit the like button. Follow them on Facebook and Instagram. But if it's your cousin Ray, take it with a grain of salt and reach out to your physician, reach out to an expert. 9:22 is the time. Tracy Duran is here. Good morning. And Josue Pais says, wow, the measles, I haven't heard about that since I was young. Yeah, it didn't go away, but when I was on the website, I saw that too. I was like, holy God, there's a lot going on with measles, with some of these childhood things that we think that we've gone past. How often do they make their resurgences? And is there ever a ascertainable period that we see them come back? Is it, every time around summer we're seeing a rise in the mumps or rubella, what have you? Is that?
Yeah. There can definitely be seasonal aspects to different viruses or infectious diseases. I mean, we definitely have a season for flu, for example.
Right.
So that definitely plays into it. I think largely these outbreaks that we see are because there's a large concentration of people that are not vaccinated, that are, either getting the infection from someone and then, coming to their community or anyone around them and spreading that infection. And when the people around them are not infected, not vaccinated, then that's how it kind of creates this outbreak. And I think for many years, measles was not an issue because people were vaccinated.
Right.
And now that we're finding people, for whatever reason, are not vaccinated or the level of vaccination is maybe lower, then we're kind of finding that these outbreaks are happening. Okay.
All right. That makes sense. And again, when I think of vaccinations, I think most people are just assuming the COVID vaccination. We're talking about all vaccinations and that skepticism that does unfortunately remain. Just musing, besides interviewing people for the right kind of information, what can we, the average individual person, what can we do to strengthen the right kind of message and also tamp down on some of that non-helpful stuff?
That's a great question. I think coming to anyone who has concerns with, a certain amount of grace and openness is really important to having these kinds of conversations. Everyone has, their concerns and comes from whatever background that may be, including, mistrust in the medical system that may or may not affect their decision making. And we have to first recognize that before having a conversation about what information we need to go with or lead with when making certain decisions. So I think that's the first step. And then kind of finding a middle ground. So I think there's a lot of great resources out there that maybe doesn't necessarily come from a physician, the health department being one of them, or community organizations that are more directly involved with the community and kind of ground level that are a little bit more approachable.
Right.
Can be a great way to kind of approach that. But I will say it's really hard.
Right.
But there's definitely people out there that have a social media presence that, including physicians, nurses, lots of people in the medical field, that their life's work is to share this kind of information
Right.
and have that kind of presence. And so finding those people, I think, is really important too.
Okay. Good
And
to know.
sometimes they can be people that you look up to.
They
So-
can be. You never know. You never
Yeah.
know. Who knows? Maybe the next future Dr. Aurora is watching this.
Yeah.
Like, I want to be like Anna Young.
Oh, man.
That'd be nice. That'd be cool. Okay. Josue Pais. Yes, Curtis, I agree. The internet is a scary place. So much misinformation out there. Absolutely. Pastor Jose Torres, good morning to you as well. Tracy Duran, good morning. And Angie Tapia, good morning to you as well. So the last question, as we start to
Yeah.
kind of land the airplane. So I'm part of this group called Compañeros en Salud, Partners
Sí.
in Health here in Aurora. And it's a group of like-minded folks and organizations and everything. So I just wanted to say that, I'm glad to support what the Illinois Department of Public Health is doing, what you guys are doing. And if there's any other way that we can help you guys out, feel free to let us know. Now, you're going to be doing the Spanish version of this show.
Yeah.
But the last question that we're going to get, so stay tuned. Get ready to tune in to Buenos Dias, Aurora, for part 2 in Espanol. The show ends on a positive note, our
I love
section.
that.
What is your message today for the people of Aurora and Illinois?
Oh my gosh. Well,
This is
thanks
the on
for
the spot part, right?
Yeah. Thank you for having me. First of all, I'm very honored and happy to be here. I think first my message is, if you ever have any health concerns or feel like you've been exposed to any sexually transmitted infection, please go get tested. Please talk to your doctor. We are here to help you. I know it can seem very scary, and there's a lot of stigma associated behind sexually transmitted infection, but these things happen and there is treatment for it. So please come see us. Please come talk to us. We can help you, and we can talk to you. We're here to support you. So I think that would be my message.
Well said. Very
Yeah.
well said. Ladies and gentlemen, we're going to go to a commercial right now. After the end of the commercial, that's it for Good Morning Aurora and Buenos Dias, Aurora, the second largest city's first bilingual news podcast. We'll start with our great guest, Dr. Anna Young. I will see you guys tomorrow. Stay tuned for the news in Spanish.
The Community Foundation was created by a group of people who got together and wanted to make a difference. 75 years later, the Community Foundation makes a huge impact on the lives of hundreds, if not thousands, of people in the community. All started with the small but promising beginnings of just a few people who wanted to do something good.
The Community Foundation is made up of all the citizens, really, who want a better community.
And really, anyone who wants to do good in the community but doesn't know how to do it, the Community Foundation is the perfect solution, because for 75 years we've been making an impact by connecting donors that care with causes that matter.
So it's multifaceted, and it's an organization that isn't there just to serve a certain small constituency or a special need, but rather the community as a whole.
So many generous donors have left a legacy with us because we are a trusted resource and we make being philanthropic an easy task.
In my mind, it always seemed like a really complicated process. Here, it's just effortless.
The Community Foundation does all the administrative work for you.
I just make a phone call, they're on it, they get back to me right away. It's been seamless.
Our scholarship program is just incredible.
I had no idea the impact that the foundation has on these kids. Some of these districts that we're working with here are some of the neediest districts in the state. It renews your faith in humanity,
I was the first one ever in my family to go to college. The scholarship from the Community Foundation has impacted my life and my wife's life in many ways. As you can see, it still brings a tear to my eye.
Without their assistance, we can't do the work that we are meant to do for the citizens of the Fox River Valley community.
You can invest your money in people. You invest it in people and
You hope and believe that the return will be great.
Someone opened the door for you at some point in your life, and it's incumbent upon you, it's your duty to help open the door for others, and you do that through service.
Not your bank's top priority? Here at Wintrust, we take a different approach to banking. No hidden fees or runarounds, but a true banking partner focused on your unique financial goals. Whether you're opening your first account, found your dream home, planning for the future, or starting a business, we have the financial solutions to get you there.